I have been honored to be on the dais to speak on a very relevant topic, that is the stress and burnout syndrome management, which we call it as a disease of modern society. In the light of social changes and transformation in the work situation, family disintegration, interest in the problem of burnout has grown over past decade. Though the burnout syndrome is seen in people working in various professions, but the people working with the humanitarian work like nurses, doctors, psychologists, social workers, and physiotherapists, and so on, they have a physically and emotionally more demanding profession, and they struggle hard to find a healthy balance between demand of their work and their own and their family life and family well-being. Many of you may know and may be aware that there are two types of stress. Stress is very important. Stress has to be there. It is inevitable. Without stress, you cannot work. You cannot move further. So, we call it as eustress, E-U-S-T-R-S, eustress and distress. Eustress is a good stress that motivates you to continue working and achieve excellence. Many people enjoy this type of good stress. Every one of us need a little bit of stress in our life to move further in order to be happy, motivated, challenged, and productive and gain recognition in society. It is when this good stress is no longer tolerable and manageable that de-stress sets in the person. Tension starts building and there is no fun in the challenges of life. The person is not motivated to work and so many things happen. This distress leads to poor decision making, physiological symptoms appear, along with the emotional and psychological breakdown. The person starts using negative coping mechanisms. And as you all know, that tolerance to stress is not equal in everybody. It is different in different individuals, different in different people, how they are brought up, what is their environment, how is their bringing up and all. All that, those factors, matters, how you, have the strength to tolerate the stress. So I think with this, I will see that in spite of all these factors, we have to be prepared to see that what all, changes and, societal changes and disintegration of family, nuclear family, the people have to have the demand at work, people have the demand at home also. So that burnout and stress occurs. Stress is an external force which is perceived as threatening. It is stimulus-oriented approach, that is, it has external attribution. You see the stimulus and you react to that. How you react, again, depends upon your strength and coping mechanism. A response reaction of an individual to a situation and event occurs. When then response-oriented approach is also there, that is when that is an internal attribution, how you take. You have got a stimulus, you have reacted to it, you have got a response, and now how that response you are taking it on you, And this is how the stress is basically a state of mind. It's nothing else. As I told you, the stress occurs in different individuals differently. Stress is the body's automatic response to any physical or mental demand placed on it. During stress, what happens is adrenaline is chemical naturally produced in our body as a response to stress. So because of that adrenaline which is secreted in the body, fight and flight response is elicited. Okay? Now, do you think that all stress are bad? No. Moderate level of stress may actually improve performance and efficiency. Too little stress may result in boredom. You have no challenge, because you have no stress. You don't like to do anything. Too much stress may cause an unproductive anxiety level. You have to identify the stresses. What stresses are there in the which you have to, that those stressors, are the stimulus. So you are responding to those stresses and you have to identify those stresses. What are those stresses? So that you can take care of those stresses, so you don't come to that level of burnout and, anxiety level. Certain situations, certain activities and relationships that cause trauma to one's physical, emotional or psychological self are the various stressors. Now we will see stress can be there in the school, stress can be there at the workplace, stress can be there at the family, the stress with the relationship with the children, with the husband, with broken family, with the colleagues, with the, at workplace, there are so many stresses and all. The demand of work also is a stressor. Relationship with others, certain legal things, you are trapped in and that becomes stressful. So then finances and all, health and illness. If somebody is sick in the family, you are sick in the family, children are sick in the family, that is a matter of stress because you need a lot of finances for that. Environment plays a very important role in the stress. With which environment you are staying, you are staying in the rural area or urban area, that hardly matters, What is your environment, what is your friend circle, what is your social circle, with whom you are interacting is the environment, and then certain living situations. All these are certain stressors which you have to identify that which stressor is troubling you the most. If you really see, there are causes of stress when we go through it. Putting things in right perspective. You have to, not to stress, not to occur, you have to put the things into right perspective. Work does not cause stress. Many people say, oh, we are working 12 hours a day, we are working, very hard and we are very stressed, I will tell you that I myself, give you my example, I can work for 12 to 14 hours a day, but I'm not stressful, I'm always happy. So, what does not cause stress? Our negative attitude towards work causes stress. Okay, work doesn't cause stress. Our negative attitude towards the work causes stress in us. Others do not cause stress. That you should know. You say, oh, she is responsible for my stress. Because I'm not getting good supervision, my supervisor is not good, my chief is not good, my HOD is not good, so I'm stressed. So others are not the cause of your stress, you should mind it. Our perception about them causes stress. Our expectation from them causes stress. And our comparison with others causes stress. Did you understand? Comparison, we start comparing, that causes stress in us. Now there are some of the negative effects of stress. Now when we are stressful, it causes some of the negative effects. Physical effects are like weight gain or loss, unexpected hair loss, heart palpitation, high blood pressure. Emotional, mood swing, anxiety can lead to depression. Can also lead to unhealthy coping strategies, that is alcoholism and drugs and smoking and all those things, when you adopt all those negative strategies. Now, physiological symptoms: increased blood pressure, heart rate, sweating, hot and cold spells, breathing difficulties, muscular tension and gastrointestinal disorders. Psychological: job dissatisfaction occur, depression and exhaustion. Then there are emotional changes which occurs in a person: anxiety, nervousness, irritability, anger, low self-esteem, inability to prioritize and poor intellectual functioning. You are not able to prioritize what is more important. You take everything together. Then certain behavioral changes also occur: impulsive behavior, ineffective communication, ineffective decision making, poor performance, absenteeism from job, high turnover, high accident rates, and high alcohol intake and high smoking. So these are the behavioral changes you will see in a person who land up with the stress. Some research findings have shown being a workaholic, being in hurry and sticking to deadlines will not necessarily cause heart problems, but anger, hostility and aggression are likely to cause stress. Okay, as I told you before also, that workaholic, some people say, oh, she's very workaholic, you know, but she's very cool. So work do not cause stress. There are certain emotions which causes stress. If you are an aggressive person, if you are angry, so if you see the definition of anger, anger is just one letter away from danger. Anger is so dangerous. It is like acid which does more damage on the vessel it is stored in. So you can see the danger of anger. Guilt. For what has happened? You are guilty. You should not feel guilty. You know, when your working mistakes are there to occur, you should not feel guilty about. You know, you say sorry that, you know, I have done something wrong, you know. So you should not feel always guilty. That guilt, you know, inside, when you're storing the guilt inside, you know, that causes stress. Worry. For what will happen in future? You're worried about your future. You are thinking about your past. You're not thinking about your present. You know, what for you are here? You do the present. You think about the present, not about the future, what's going to happen. You know, these are all the emotional causes of stress. What happens when the stress occurs? What are the consequences? There is a strong link between stress and coronary heart disease that we have seen so many studies and all. Back pain, headache, stomach pain, intestinal problem, upper respiratory problem, all these physiological problems occurs in a man. Stress is linked to 6 leading causes of death: heart disease, cancer, lung ailment, disorder of liver, accident and suicide. Now this is the model which you can see about the performance and the level of stress. Optimum level of stress causes optimal stimulation in you, and you become more creative, you progress better, you excel in your career, and you have the rational problem solving. When you are under-stimulated, when no stress, then it causes boredom, it causes frustration, it causes dissatisfaction, but you feel that you are just nowhere, you know. And overstimulation, that is, you feel exhausted, you become ill, ineffective problem solving, and you develop low self-esteem. So you have to find the right balance. What is that right balance? Aspect of life which need time. You have to have the right balance among these: career, wealth, relationship, health, and spirituality. You need time for all these things, but you have to balance the time. How much time you are going to give to your career, how much time you are going to give for making wealth, how much time you are going to make for keeping the relationship in the family or at workplace, how much time you are going to give to yourself to be healthy, and then the spirituality is also an important factor. So you have to keep balance. If your spirituality, you are praying for 3 hours, 4 hours, then you are getting late on duty, you know. When you are taking care of your health, you are so much preoccupied with your own health, you know, that then again, you know, there will be some problem somewhere, you know. So you have to keep a balance in various aspects of time, and all these aspects of life needs time where you have to keep balance. Once the balance is kept, you are perfectly, you know, good. Managing stress. Attitude is fundamental to long-term stress management. Hence, have a positive attitude. All of you, I advise you to have a positive attitude towards your life. Never take anything negative. Just think that whatever negative has happened in your life, that is a learning lesson to you. So always adopt a positive approach and positive attitude in life. Know your strength and weakness, and know your limit of stretchability. Where you can stretch. Everybody knows their strength. Everybody knows their weaknesses. Everybody is not perfect. If we have weaknesses, we try to overcome those. If we have, those strengths, we have to prove those strengths, and bring it further to the society, that whatever strength you have, and put it into practice. Build your energy through proper diet, sleep, and exercise. Minimize your expectations from others. Keep on doing. Don't expect. Expectation will make you more stressful. Whatever you want to do, you do. Always do the good for others. Be helpful. Have a good relationship with others. If other people do not pay attention, just forget about it. It's not that you will stop talking to that person. Okay? So you don't have to keep any expectations from anybody. You keep on doing whatever, God has given you the work to do. Develop a holistic perspective. Okay? Live in the present, not in the past or not in the future. Live in the present. So with all these things, you can manage the stress. So these are the various stress relief strategies which we'll practice at the end of the lecture. Body relaxation exercises, breathing techniques, guided imaginary. Now breathing techniques everybody knows, deep breathing, exhale, inhale in and exhale out, breathe in and breathe out. These are the best exercises for your stress relief. Guided imaginary. Imagine, close your eyes and imagine the best thing you like, Imagine if you like animals, you like dog, imagine the good dog is your company. If you like nature, imagine that you are going to the, forest and going to the garden and enjoying the, So imagine that and close your eyes and see that, that give you a relief. Physical exercise such as yoga, workout routine, meditation, counseling, talk therapy, and life coaching. So you have to adopt these styles for if you have developed any type of stress in your life. Now, there are certain, unhealthy ways of, coping with stress, like smoking, drinking, and various other things, So those are the negative, unhealthy style, of coping. Then there are certain positive ways of coping. Count your blessing. Do good and count your blessings. How many people you have helped? How many people, how many times you were honest? How many times, you have, taken care of somebody who is in need. So take blessings. Keep on collecting blessings, Get into some physical activity. It relaxes both mind and body. Seek company. Being alone can make you more frustrated. Be in company of your children, with your husband, with your friends, with your classmates, with your, not always on the phone and not always on the computer and not always on the, nowadays we have seen, that social interaction has decreased. Even the person who is sitting next to you, you are, all the 4 family members are just sitting on the WhatsApp and on the FaceTime and all. That is decreasing the interaction with each other, So you have to have the time to talk to each other. Accept problem as part of life. Remember the present situation is not permanent. Okay, when you compromise your values and beliefs and still you keep on working, that also causes a lot of stress. Schedule me time, schedule your time. you also have to have the time for yourself. So schedule the time for yourself. Relax. Relaxing is very, very important. It's not that you sleep, but relaxing. Our brain fires electrical waves at 14 or more cycles a second. You know that? So these are the beta waves, and are great for getting tasks done, but not for learning new things. Taking a few minutes to relax deeply slows down your brain waves down, and these slower waves are alpha waves. When you relax, those beta waves will settle down and alpha waves will take over. They occur at between 7 and 14 cycles a second. Study shows that alpha waves improve learning. So in between naps, in between relaxation, in between the works, will cause alpha waves to be activated and you feel better. So all of you know that benefit of stress management. Physical health gets better, more energy and stamina you will get, emotional stabilization occur, positive attitude develops, and you become more hopeful, more happier, ability to focus improved, and able to learn and achieve and excel in your career. When this stress, with these techniques, your mild to moderate stress is not able to, cope up, and you are not able to tolerate, and you're panting up inside, you don't have any time to go and seek help from others, and you are panting up the feelings and all of stress, that burnout occurs. Okay, that is the difference between stress and the burnout. Okay, so burnout, it is a stress syndrome. Okay, that it is a syndrome which occurs, when you are not able to cope with the stress of your life, and when you are intolerable to stress. Emotional sadness and depressive mood, negativism, decreased creativity, and increased cynicism occur. Interpersonal manifestation occurs, quickness to anger, defensiveness, edgy and ready to blame others, and a negative word view. Whole of the world has become negative when you burn out. Okay? It is often correlated with the process of grief, as a work-life dream is lost. You have got so many dreams, you are not able to do it, your work-life dream is lost, and you feel you have become worthless, you have become useless, the depersonalization occur, that you are not looking nice, you cannot go to the society, you cannot talk to the people, everybody is laughing at you, So all those feelings occurs, in burnout. Depersonalization and distancing occur, from patients, staff, relation, family members, friends, and disorganization and ineffectiveness increases. So you can see the effect of burnout is much more than the stress if it is not being coped properly, and you reach to this situation. Now you need professional advice and you need professional. There are certain common causes, that is work overload, lack of reward, belief and lack of control, issue of unfairness. That is, what is issue of unfairness on workplace? Your job performance is not properly rated. You are doing your work, but it is not recognized. And unfairness in your appraisal, unfairness in your performance appraisal, and your other promotions and all those things, So all these causes stress in life, and it causes burnout. Now this is sometimes, if you see this burnout risk inventory, all of you should just go through it and see that these are the various risk inventory. That is, are your achievement your self-esteem? This is your inventory and you can rate it, And you can see that when you feel that your achievements is your self-esteem, no, it's not your self-esteem. Your achievement is okay. If you have failed in something, it's not that your self-esteem should go down. You practice again and again and again to come up, Don't take it to heart. Do you tend to withdraw from others of support, that anybody wants to help you and you have withdrawal, that no, I don't need any support? Will you ask for or accept help? Yes, when you are sick, you ask for help. Do you often make excuses like it is faster to do it myself than to show or tell someone? I don't want to take anybody's help. I can do it on my own. Do you have a close confidant with whom you feel safe discussing problem? Are your work or relationship asymmetrical? Are they always giving? So these are the various burnout risk factor which I give the handouts. You can make the handout and give it to everybody. So these are the various burnout risk survey, and you can do the survey for yourself, and you can even someone of you can take the research also on this burnout survey, and you can do that on your staff and on your people. That how much it will help you. Big risk. At risk earlier in career. Lack of life partner. These are the big risk one gets burnout. Attribution of achievement to chance or others rather than one's own ability. When you have these big risks, you must go and take help. You feel that others are responsible for your shortcomings. You are not able to do, it is a chance, and it is, others are responsible that you are not able to do it. Passive defensive approach to stress, lack of involvement in daily activities, lack of sense of control over events, not open to change. So when these things happen, these are the big risks in somebody's life, and you have to take help from the professional. There are certain adaptations and consequences of burnout. You start working for longer hours. If I work hard, it will get better. You have that feeling comes, If I work hard, I'll gain something, Withdrawal. You withdraw from society, withdraw from other. You don't talk. You have just finished a friendship with the people with whom you were friends. Absenteeism from work, reduced productivity. Depersonalization occurs, attempt to create distance between self and the patient. You are not giving even the patient care properly. The patient also identify that you are not taking care better. Trainees by ignoring the qualities and make them unique individuals. So you keep distance from people, you keep distance from students, you keep distance from staff, you keep distance from your colleagues and all. And depersonalization occurs. What is depersonalization? That I'm not good. I'm just good for nothing. I'm looking ugly. That is depersonalization. Those type of feelings are very, very harmful. So one has to see that if those feelings occurs. Loss of professional boundaries leading to inappropriate relationship with parent and trainees, and compromised patient care. Patient care also become compromised because you don't feel that you are fit to nurse a patient, or you are fit to take care of that patient. These are the additive stressors. Despite the notion that burnout is primarily linked to work-related stress, there are personal life events also demonstrated a strong relationship to increase the professional burnout. Your family and your work is not balanced. In spite of achieving career and financial success, health professionals are stressed and overworked, often losing sight of their career goals and personal ambitions. The resulting frustration, anger, restlessness, exhaustion, and adversely affect the quality and cost of patient care. Additional dangers include compassion fatigue, burnout, and vicarious post-traumatic stress disorder in healthcare setting, especially Medicaid and the uninsured. Now, as I told you that this stress and burnout is more common in the people who are working for the human beings, that is nurses, doctors, and this thing. So these are the various, most of you are nurses sitting here, faculty of nursing, your students are there and your people are there, You can see that you have to identify and prevent the nurses burnout. It is your duty as faculty, and it is your duty because since this is the staff development program, you have to see that which person is burnout, who is under your judiciary, who is under your care, who is under your students, your colleagues, your people who are around you. You have to identify the stresses present in them. You have to ask, you have to see and observe. Do you have chronic fatigue, anger or self-criticism, a sense of being under siege, or frequent headaches or insomnia, or other things and all, sleeplessness and depression and all? So you have to identify the symptoms of burnout in yourself and in your colleagues with whom you are associated with. If you find that you are experiencing any of the indications of stress or burnout, these are the things that you can do in order to bring some calm back into your life. The 3R approaches you should adopt: recognize the stressor, reverse the stressor, and resilience. You have to see that you calm down, with whatever is there in your. Now, what can I do? Many times you see, when I'm stressed, when I'm burnout, what should I do? Now, what should you do? Ask for help, talk to others about your difficulties and seek their support, develop a plan to address burnout. You have to really, come forward to bring out to someone so that the people can help you. Rest and retreat, release, regroup, make personal changes and regenerate. Find purpose and meaning in activities at work, at home and community. Handle workplace stressors, they manage me. They should not handle workplace stressors before they manage me. Okay? Reevaluate my goals and priorities. This is what you should do. You have to reevaluate your goals and priorities. Do not take the whole load myself. Learn my own limit and set limits with others. Have the guts to say no sometimes. Every time you should not be ready. Ask for what I want and do not assume that I will get it. So these are some of the strategies, you should keep in mind. Preventing burnout, know your stress danger zones at work and at home, avoid or address the danger as soon as possible, and daily self-care is very, very important. There is Help Guide organization, which is a trusted non-profit guide to mental health and well-being. You have to see that every day, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, whole week inventory. You have to prepare for yourself, and see that, make your own stress journal. What made you stressful? You make your stress journal every day, and write down and tick mark, So these are various, exercise for 30 minutes, avoided unnecessarily stress and all, talk face to face with a good listener, alter the stress situation. So all these journal, you have to prepare a journal for yourself and evaluate your stress level. Then there is a, Mashlek inventory, which is a, tool to, which is a, paid, you have to purchase that tool, psychological tool which is called Mashlek inventory. You can, check your stress level. You can use that for your research purpose also for others, It is a paid tool and you have to take the permission for that, Mashlek inventory and all. So my key word here is that keep balance. Keep balance in your work life, keep balance in your home life, keep balance in your spiritual life, keep balance in earning the wealth, So you have to keep balance and your life will smooth and run, and take a speed, towards a proper goal.